Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video about unexplained skin reactivity, sort of skin allergic type reactions. Someone had messaged me on Instagram. I'm just asking about possible underlying causes of this, and I think it's a really clinically fascinating topic, and it can just be so vexing and perplexing as to why these types of reactions might happen to someone. Of course, the best route is to have a clinician thoroughly work up the case and try to figure out what's going on. And so this is just kind of me sharing some of my experiences up to this point in terms of what I've seen with some of the cases in my practice. So one of the things that the individual had mentioned or asked about was about possible mold-related issues, and certainly it's something that's a good idea to have on the DDX list. Certainly a good thing to have, with whatever clinician is managing the case. It's certainly something that should be on the DDX list, because anything that might contribute to or be the causal agent of mast cell activation syndrome would be a really important thing to rule in or rule out. Mast cell activation syndrome, or MCAS or MCAS, whatever you want to call it, is this basically condition where the mast cells in the body, which are these cells that release histamine and other sort of pro-allergic, pro-inflammatory mediators, get triggered too easily, and they release more of their histamine contents and then cause more allergic symptoms or sort of typical hypersensitivity symptoms. So in some people that might be red or itchy skin, or like blotching on the skin. It might be heart palpitations, it might be diarrhea, it might be anxiety. All of those things could cause just like a weird body buzzing kind of sensation. Some people feel really warm. There can be other symptoms as well. Some people get really tired, as a result of that. And then in some people, they have an exacerbation of any of their underlying pre-existing pro-inflammatory symptoms. Or rather inflammatory symptoms, because histamine can contribute to that sort of inflammatory milieu in the body, making all those symptoms worse. So they might have more, brain fog or joint pain or other things in that inflammatory type symptoms. So, so anything that might cause MCAS or contribute to it is something that should really be considered and worked up by the attending clinician. So, mold illness would certainly be on that docket. Also, any kind of dysbiosis in the gut, particularly small intestine bacterial overgrowth or SIBO, should be worked up, because there's a clinical correlation between MCAS and SIBO. Also working up for any possible underlying chronic infections or persistent infections, like possibly persistent borreliosis, sometimes known as chronic Lyme disease, or in particular Bartonellosis, which is a co-infection of Borrelia, is more classically clinically correlated with MCAS, and other co-infections could be triggers or culprits as well. Now, it really depends on the clinical picture. So if the clinical picture is, quote unquote, just this, sort of hyper-responsive, hypersensitive, allergic type skin picture, and there's no fatigue and muscle pain and joint pain and crazy neurological symptoms, brain fog, there's not kind of the whole 9 yards going on with symptoms. In my experience and in my opinion, the likelihood of there being something more insidious like a chronic infection afoot is on the lower end of the spectrum. If there's no digestive issues, the likelihood of something like SIBO being afoot is not quite as likely. But that being said, I've had patients, especially young patients, like pediatric patients, where their digestion's quite good, but they're just a bit bloated, and maybe their bowels are a bit irregular, or their skin seems to get somewhat worse after they eat certain foods. And one of the many, many advantages of being a young person is that the body's still so full of growth hormone and all these anti-inflammatory factors, so many endorphins, that they ultimately don't necessarily experience symptoms the same way that someone who's fully grown or, getting into their 30s and 40s and beyond is going to be experiencing symptoms more fulminantly potentially. So it's one of those things where it really has to be worked up by sort of a clinician who really pays attention and is seasoned and sort of knows about all these different little nuances to look out for. But just as a general rule, if there aren't obvious gastrointestinal symptoms, then it's probably, it's less likely, I should say, that it might be related to something like SIBO or whatnot. As I'm paying attention to the time on this video, I'm realizing that I'm probably not going to get it all crammed into one video. So what I will do is end it there, and then I will post the next video kind of finishing up, fleshing out this topic.